Female infertility can result from various factors affecting the reproductive system. These causes can be broadly categorized into ovulatory disorders, tubal factors, uterine and cervical factors, age, lifestyle factors, and other medical conditions. Here are the main causes of female infertility. Ovulatory disorders. Polycystic ovary syndrome, PCOS, a hormonal disorder causing irregular or absent ovulation. Hypothalamic dysfunction, disruption in the production of hormones by the hypothalamus affecting ovulation. Premature ovarian insufficiency, POI, early depletion of ovarian follicles before the age of 40. Hyperprolactinemia, elevated levels of prolactin interfering with ovulation. Tubal factors. Fallopian tube damage or blockage, often caused by pelvic inflammatory disease, PID, endometriosis, or previous surgeries. Ectopic pregnancy. Pregnancy occurring outside the uterus, usually in the fallopian tubes, can cause damage. Uterine and cervical factors. Uterine fibroids. Non-cancerous growths in the uterus that can interfere with implantation. Polyps. Benign growths on the inner wall of the uterus. Congenital uterine abnormalities. Structural issues present from birth, such as a septate uterus. Asherman's syndrome, formation of scar tissue in the uterine cavity, often due to surgical procedures. Cervical stenosis. Narrowing of the cervix, which can affect the passage of sperm. Endometriosis. Description: presence of endometrial tissue outside the uterus, causing inflammation, scarring, and adhesions. Impact: can affect the function of the ovaries, fallopian tubes, and uterus. Age. Description: fertility naturally declines with age, especially after the mid-30s. Impact: reduced quantity and quality of eggs. Lifestyle factors. Weight. Both underweight and overweight women can experience infertility due to hormonal imbalances. Smoking can damage the reproductive system and reduce egg quality. Alcohol consumption. Excessive drinking can interfere with ovulation. Caffeine intake. High levels of caffeine can negatively affect fertility. Stress. Severe or prolonged stress can impact hormonal balance. Medical conditions. Thyroid disorders. Both hypothyroidism and hypothyroidism can interfere with menstrual cycles and ovulation. Diabetes. Poorly controlled diabetes can affect menstrual cycles and ovulation. Autoimmune disorders. Conditions like lupus or rheumatoid arthritis can impact fertility. Cancer and cancer treatments. Chemotherapy, radiation, and surgery can affect reproductive organs and functions. Other factors. Genetic conditions, such as Turner syndrome or Fragile X syndrome, which can affect reproductive health. Sexually transmitted infections, STIs. Chlamydia and gonorrhea can cause pelvic inflammatory disease, leading to infertility. Medications. Certain medications, such as long-term use of NSAIDs or antidepressants, can affect ovulation. Unexplained infertility. Description: in some cases, no specific cause can be identified despite thorough evaluation. For women experiencing infertility, a thorough evaluation by a healthcare provider or a fertility specialist is essential to diagnose the underlying cause and determine the appropriate treatment options.